My name's Richard Ryan. I'm a professor of psychology at the University of Rochester, and I do work in self-determination theory.
Okay. What department?
I'm in the Department of Psychology. I'm also in the Department of Education and in the Department of Psychiatry, but my main appointment is in psychology.
And the presentation at this conference is about self-determination theory, right?
Yes, it is. I'm going to talk about self-determination theory and how it relates to flourishing and wellness.
Okay. How'd you get interested in that particular line?
Human motivation, that line? Oh, many years ago when I was training as a clinical psychologist, I had no intention of becoming a researcher or a theorist. I just wanted to be a private practice clinician. But I did some work in the schools with teachers on motivation in the classroom. And not only had a big impact on motivation for the children in their classroom, but also on the children's self-esteem and well-being. And I saw how big an impact that had across many people. I thought I could never have that impact as an individual. So I thought I would go into the field of motivation and see if I could do interventions that would affect more of the population than I could do as an individual clinician, and got interested in the area from there.
So what is the center of the work that you're doing now?
Well, self-determination theory is really about facilitating people's volition and willingness when they're engaged in activities, so that they put their whole heart into what they're doing and they're therefore both happy and performing at the best they can do. So it's really a theory about how you can do that facilitating of people's energy and motivation.
Can you give me a couple of examples?
Well, sure. So we think of when we think about motivation, we can think about things that we're doing because we want to do it, and we can think about things that we do out of value, and we can also think about things that we do because we just have to do it, or somebody's making us do it. And so right away you can feel the difference in what it is like to engage in activity when you're feeling forced or when you're feeling autonomous. That's our main distinction. And so what I might do is workshops with teachers to help them be more autonomy supportive in the classroom. That would include techniques like how to provide choice, how to give feedback in a way that's not controlling, how to communicate in a way that feels more initiative supportive and spirit raising, issues like that. So do those kind of interventions in schools and look at the impact over time on children as an example.
Okay, good. And if you were to present the same material to coaches as you are here, how would it shift?
Well, so I also do work with psychotherapists and with coaches and with managers in workplaces, because we all face the same issue about motivating ourselves and motivating other people. So it's really about refining the techniques with which we do that.
Is this something that really has to start with the individual practitioner? In other words, where we would stress with the coach that they have to learn it for themselves and then they begin to teach it to their clients, or is that not so important?
Well, Joan, I think that's important. I think it's hard to be supportive of autonomy if you don't know what it is in yourself, and if you can't feel the difference between your own volition and your alienated actions, it's going to be hard to promote those in others. So I think there's a lot of self-awareness that a clinician or a coach has to have in order to support the motivation of other people, both about what their own motives are and also to be sensitive to what's going on in the other person.
And I should be transparent about that. It's a particular interest of mine, is how much any theory needs to be taken in fully by the person who wants to use it with anyone else before they can. You've got to walk your talk, I guess, is the phrase.
Well, I think one thing I found with self-determination theory is I might be going to work with physicians, for instance, on motivating patients, but then they get interested in the discussion of how they can motivate their children or what they can do in their workplace. So motivation applies everywhere, and of course it's a personal issue for all of us.
Can you give me a definition of self-determination theory?
Oh, well, I can give you a brief description of self-determination theory, which is that it's a theory about basic human needs. The theory argues that all of us have some very, very basic psychological needs to connect with other people and feel belongingness and relatedness, needs to feel effective and mastery in what we're doing, and a need to feel autonomous, or that what we're doing is our own initiative and our own value. And much of psychology is focused on efficacy and competence, but very little psychology is focused on the issue of autonomy and volition, and too little psychology is focused on relatedness and connecting. So I think the theory is really focused on how, in any context, we can maximize the satisfaction of those three basic needs for autonomy, for competence, and for relatedness. So the theory is really about that.
And the work that you do with it, describe for me a little bit how you use this.
Well, I'm a clinical psychologist, so in my own work as a therapist and as a facilitator of change, I'm always using principles of self-determination theory to support the autonomy of my clients, or in interventions to design things to maximize people's initiative.
What might that look like?
So that would, first of all, I guess the most important thing in supporting other people's autonomy is walking in their shoes. It's about empathy, taking their internal frame of reference. So if somebody's, for instance, not motivated, there's always a good reason, and we have to find that reason. So it's about getting inside the worldview of that person and the internal frame of reference to find out, well, what are the barriers for them? What are the conflicts, the barriers, the competitions in their own souls that are keeping them away from something? Or maybe it's just that there's truly a lack of interest or value for the activity. So it's exploring where those barriers are. So as a starting point, it's also looking at where the promise and the mastery and the competencies are, so that those can be built upon. So all of autonomy sport begins with empathy. And then beyond that, it's really structuring environments so that people have maximal choice and people can pursue the things that really matter to them.
Can you think of any specific examples that would illustrate what you're describing to me?
Yeah, I'm just going to give a very, very simple one. One of my colleagues, Martin van Stinkest, was working with eating disordered women recently in clinics in Belgium, and he finds a very high attrition rate. People drop out of treatment very quickly. What he looked at when he went to consult on this is simply that there's very little choice involved. People were forced into treatment right away without really being able to reflect on whether they could be there or not. So he's changed his program very simply. He simply allowed people to stay there and observe for a week before making the choice to enter treatment. That small difference, just actually making a choice, seemingly small, huge difference in attrition rates just by bringing in an opportunity for choice.
So if I understood that, Richard, allowing the self-determination, allowing the individual choice,
right,
is the crucial shift there.
Another example might be if I'm working with a manager and employees are balking at some initiative that's been started. Oftentimes they don't know the reason. So a rationale really helps people to be more autonomous, but they have to know what the rationale is, and communicating a rationale, giving people a reason to do something, really helps them become more volitional. We often leave that out of our motivational initiatives.
Cool. As we were talking about before, health and wellness coaches are really cutting edge in our field right now. And their job is to help their clients towards practicing healthier lifestyles, mindsets, and all. How does your work interface with that? How would it?
Well, first, we've designed a lot of controlled clinical trials using self-determination theory interventions in weight loss and smoking cessation and diabetes regulation and even dental hygiene. So basically all the different aspects of healthcare where your behavior makes a difference. We've designed some interventions that have already shown clinical effectiveness. One of the key things that we do, though, is we never force anybody toward any particular outcome. And I just use the example of smoking cessation. For instance, we have a smoking cessation program. Our goal is never to get people to quit smoking. Our goal is to get them engaged in a conversation where they're really considering what they would like to do about their health. Because it turns out most people, when they get into that conversation in a deep way where they're not being pressured toward an outcome, who are smokers, would like to quit smoking. But getting to the place where you really can have an honest conversation about why you're not, why you would, what those barriers are, is really a key part of our intervention.
It's almost the reverse of the way that we would traditionally do something.
Right.
We would start from, well, of course you want to quit.
And of course we know what the right
that
outcome is for you.
Which immediately puts somebody on the defensive, I would think, or is likely to. Yeah, so it's really shifting the whole.
Yeah, and I think that's really the idea in autonomy, is we're shifting responsibility over to the person so that they can own what they're doing. And when they do that, they are much more likely to carry through.
What do you think is next in your research? Where are you going?
Well, SDT's grown so fast over the past 15 years that it's really research is all over the place. So research is going on on sport fields with coaches in health clinics and every applied area of life. Basic research, though, is really what engages me. So one of the things I'm engaged in are people's non-conscious and conscious motives and how they align. So I'm doing a lot of work right now looking at when people say they want to do something but they really don't on an affective level. Can we predict that? So we use experimental techniques to look at that discrepancy, and then we're showing that after either bringing people to a more mindful state or more autonomy, they're more congruent. So they're less divided between their conscious and non-conscious motives. So that's an area of work right now.
That's very cool.
And doing a lot of work on the impact of autonomy on health outcomes directly. So whether when you're in more autonomous states, do you have more immunological resistance? So we have some studies where people have a mild antigen injected into them, and we're seeing whether they have better immunological response when they have more autonomous motivation ongoingly. So some basic research is what interests me a lot, and also
basic but impactful.
Yeah,
Important.
And cross-cultural research. I'm doing a lot of work cross-culturally. I just got back this week, as you can see from my baggy eyes, from Asia, where I've been doing some work in Singapore and Hong Kong in the school systems to bring more autonomy and intrinsic motivation into classrooms there. So as we know, a lot of, say, Singaporean kids might do well in school. They do very well on tests, but they may not be interested in school, and then when school's over, they may not be interested in learning or lifelong learning. So the idea is how to bring more enthusiasm and excitement into classroom learning in Asian high-achieving cultures.
That's wonderful. That's really good. Okay, my last question, I've been trying to ask this of everybody. If you were talking to somebody who was entering the coaching profession, and how does your work apply to them? How can they use it out of the gate to improve their practice?
Well, I've been pretty happy with the emergence of the field of coaching, and I learned about it kind of secondhand. I'm a clinical psychologist, but my nephew and my niece both became coaches. One became an executive coach, one became a life coach, and they taught me about the field, so to speak. And right away, what I saw is that coaching is really about facilitation. It's really about helping people reach the goals that they would like to reach. And I think it also helping them to identify the goals that are truly theirs, that are really authentically what they'd like to be. So I think self-determination theory is all about both these things. It's about facilitation and authenticity and autonomy. We're trying to bring those conditions about for everybody. So I think it really applies to the field of coaching. And I think, there's a burgeoning field here of application that
it's kind of a natural fit.
I think it's a very natural fit.
Yeah, that's good.
Yeah.